Hey there, I am Julie Hirschberg from Reactive PT and Wellness, and coming to you today for another Friday Facebook Live. It's on these Fridays that we have been diving into some of the interesting topics and conversations that are coming up for us, especially in our movement disorders fellowship. And we just last night did a learning module on functional movement disorders. And I wanted to just give a very brief recap, talk about some of the discussion that we had. We had some really great people joining our group with some serious, strong interdisciplinary teams for functional movement disorders. And I learned a lot just in discussing with everybody. And one of the things that was really nice is we sent out ahead of time just what kinds of questions are coming up for people. And one of the biggest questions, actually kind of three big questions that we'll talk briefly about today is, how do you talk about the diagnosis? Is it real? Who are some of the key members on a team, and what are some of those key pieces of treatment? And probably the most interesting part to me is actually the educational piece and the talking about the diagnosis. And I think one of those big misconceptions is that it's not real. And maybe the person has even been told that it's not a real diagnosis, that it's in your head. And one little piece that we talked about, we talked about this a lot last night, but we talked about a study by Maurer and colleagues that looked at functional connectivity with functional MRI imaging. And I think particularly in functional movement disorders, this is going to be an area of future, maybe even diagnostic tests. But they looked at connectivity in healthy controls and people with functional movement disorders and showed distinct patterns, in particular between the connectivity with the right temporal parietal junction and the bilateral sensory motor regions, which is a key area of control of self-agency. And this is a really interesting topic to me in general. So we talked about that, and maybe even this idea of using some of these studies in the functional MRI imaging to show the reality of this, the reality of the disorder. And just like I know I've used these images for people with Parkinson's to show what the brain looks like with exercise. I think a similar kind of thing to educate people using some of these images to show, look, no, there's not like a distinct lesion in the brain, but there is a problem with connectivity or connection. And so that's something personally for me that I feel like I would really use is some of these images from the literature to show that. So that was one of the big things that we talked about tonight, was how you talk about this and how you educate, and the power of education for sure, which means the people that are on the team are so important. We talked about this a lot. A lot of the people in our group last night were part of an interdisciplinary team, and having a really great movement disorder specialist on the team who can talk about the diagnosis and not allude that it's in your head or it's all psychological, having psychology on board, social work, speech therapy, occupational therapy, and we're so lucky to have a really awesome occupational therapist who focuses on lifestyle interventions, which is a huge part of recovery. So those are some of the key pieces of the team, and I think there's a lot of great teams out there. I actually posed this question to a professional group who also said, yes, this is, we're part of an inpatient rehab team, for example, and there's a couple of great studies out of Mayo and Kentucky with inpatient rehab teams, which I think is really awesome for the functional movement disorder. And then in terms of treatment, one of the pieces that we talked about a lot was the optimal theory. And especially using those external cues and providing autonomy and the power of education. So how showing and demonstrating using something like an external cue that some of that movement is there, the capability is there, but the connection is off, shows that that connection is possible through retraining. And Chelsea Richardson, who presented her case with this, showed a really powerful view of this for a person who essentially had like legs glued to the floor, and then with that external cue could access some of that movement. And it was really powerful. So the use of that optimal theory, external cues, those enhanced expectations, the autonomy piece, which can be so important when there is a deficit in self-agency. Those are three big pieces and cornerstones of the treatment in functional movement disorders. So a lot of great discussion in this realm. We could have gone a lot deeper, and we could have spent a lot of time, to be honest, discussing how we do this as physical therapists, some of those pitfalls where we find that we get stuck sometimes. And I think it's really nice to be around other physical therapists, other neurologic physical therapists to help figure those things out together. It's really powerful to me to do. So I wanted to thank you for joining us today. If you're interested in the learning module, we did record it, so it is available. And if these kinds of topics are really interesting to you, we are doing a weekend course on CRPS and dystonia. And actually a lot of the physiology, some of the education pieces, the optimal theory, that's all a big piece of intervention in those disorders as well. And I think it actually really applies to everything that we do. So I would love for you to join us for that weekend course. It's going to be in October, and the link is also available on your website, and I'll post it here in case you're interested. And thanks so much for joining me on a Friday. I look forward again to seeing you next week, and have a great weekend.